Treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Dr. Gil Lederman.
For new or recurrent cancers, Radiosurgery New York specializes in new, non-invasive outpatient cancer treatment choices. First in America, first in New York, first for you. Radiosurgery Cancer Treatment. Decades of experience with primary and metastatic, large or small cancers. Cancer treatment from head to toe, acoustic neuroma to prostate cancer. We hit the cancer with no cutting, no bleeding. I'm Dr. Gil Lederman. We're the cancer treatment radiosurgery pioneers, with possibly a second cancer treatment choice for you, even if chemo, radiation, or surgery didn't work. Most insurances, Medicare, Medicaid accepted. Hyperthermia too. Tune in our WABC radio program Saturday mornings at 6:30. I'm Dr. Gil Lederman. Call me at 212-CHOICES, 212-CHOICES to hit the cancer. Super convenient, 38th and Broadway in Manhattan. 212-CHOICES, 212-CHOICES to hit the cancer.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Good morning and welcome back, Rob, John.
Welcome back.
Listeners. Promised to give new news. We have some new news from ASCO, which is the National Society of Chemotherapy Doctors, of which I'm a member also. And one of the big questions is when to stop chemotherapy. And some people say, well, you start chemotherapy, you never know when you're going to stop it, right? So when am I going to get off chemo? So it was a study from Holland that looked at virgin patients with metastatic colorectal cancer. Mm-hmm. So they were diagnosed and the cancer had already metastasized. So virgin patients usually do better than people who've had lots of treatment because lots of treatment makes the cancer resistant.
Okay.
So these are virgin patients, so they should be doing better. And the question was, if you start chemotherapy, let's say you give 4 months of chemotherapy, and then you randomly allocate patients to no treatment or chemotherapy, which group does better?
I would hope with chemotherapy.
Well, you always hope because as doctors we think that treatment means success.
Right.
I mean, that's you go to the doctor and you get treatment, you think it's success. So that's kind of part of the problem with like proton beam we talked about before. If you label it a treatment, you think it's going to be something fantastic. So anyway, this study was virgin patients, and they were trying to study the optimum duration of chemotherapy with metastatic colorectal cancer. It's actually never very well been studied, and they were using capecitabine and Avastin after induction, with 4 months of induction, which means initial treatment, and then randomly allocate the patients. So some patients continued on the treatment, and some patients just stopped the treatment. And then they looked at the median episode of progression. Well, you'd think that the group that got chemo would have progression of their cancer at a later date than those who stopped the chemo, and that was true. So the people that were on the observation arm had progression of the cancer after 4 months. Mm-hmm. And those who had chemotherapy had it at 8.5 months. So it's true that it slowed down progression, but then the second progression was at 11.8 months with chemo and 10.5 months with observation. So you can see the gap is narrowing.
Right.
And actually, probably the most important thing was the survival data. and the survival with observation was 18.2 months and 21.7 months with maintenance chemotherapy. So you're talking about 3.5 months difference. And then there were side effects. There was hand and foot syndrome. Without the observation arm, it was in 0% complication rate. With chemo, it was 22%. There was neurotoxicity, which means damage to the nerves, in 10% of the chemo patients and 5% of the others. So it was a modest difference. It actually wasn't probably as much as you all. John, you're a lay person. Would you take chemo for 2 years to try to live 3 months longer with the complications, or would you stay home and live it up and go to the beach?
I think I would try to fight it. I think I would go down the chemo route.
You'd go on the chemo? I
think so, yeah.
Even for 3 months difference?
It doesn't necessarily seem like the best case scenario, but yeah. If it would, for 3 months, just 3 months. I don't know. What do you see in most of your patients, Doc?
Rob, what would you do?
Yeah.
Well, I'd come to see you, first of all.
No, you're a doctor. You're a doctor in training. You know what it's like.
There's no way I would do the chemo.
I mean, yeah. I guess when you talk about it like that, it you got to weigh in the positives, negatives, and sort of see.
My son, hopefully, is listening, and he's read this article. Why do doctors die differently? Because doctors often read this data and they say, wow, if I have 2 years to live, maybe, I'll do something different. If it's 3 months, maybe I just live up my life and try to go to Hawaii and see the world and go to the Taj Mahal and see Aunt Nellie and Roma. And so different people do different things. Yeah. And obviously each patient gets to choose what they want. But I think the point of it is we should all discuss the data with the patient. You should be sitting there saying, okay, Mrs. Jones, these are the two options. We can go on chemo. Some people choose radiosurgery. I mean, we just give a shot of radiosurgery. It takes 15 minutes. We can put the cancer in remission. And then you can go and you feel like at least you've done something against the cancer, which is pretty effective. It's outpatient therapy. You don't have the toxicity and hand, foot, and blood counts and injections and all that stuff. And so sometimes there's a happy median between 2 years of chemo and nothing, and often we'll treat those patients with radiosurgery. So it's non-invasive treatment, pinpoint, usually works, and usually gets the cancer in remission. We're getting near the end of the hour, which is really sad. We have two other shows, and they're full hour shows on WOR. So that's your competing station, John. So I apologize about that, but maybe you can find me more time on CBS, on ABC soon. I hope that.
That's it.
So tomorrow we're on 6 to 7 on WOR AM in the morning and 9 to 10 p.m. And we actually have a special show. A couple of weeks ago I spoke about Dr. Paul Offit. You remember the doctor who wrote about vitamins and how people who take mega vitamins actually have a 22% higher death rate?
Yeah.
Well, next Sunday, in 1 week, Sunday night, he's coming on the show as a special guest. And he's an amazing guy. He's written several books. He's an amazing guy. So I hope listeners tune into that show. It's WOR, Sunday night, September 8th at 9 p.m. During the week, we're happy to take your calls also. Our office number is 212-CHOICES, 212-CHOICES, which is 212-246-4237. You can call with your questions. You don't have to be on radio, because I know a lot of people are bashful about being on the radio with their personal questions. I'd urge women who have a lump in their breast to come in. We had another woman come in who had a lump for 3 years. She ignored it, and she came in this week. We did a little biopsy, which was painless. We staged her. The cancer was localized. So I would urge women with breast lumps to please come in, seek medical attention, and hopefully we can cure you painlessly. Thank you, Rob. Thank you, John. We're ending the show. We have a free booklet and DVD for those who call in. So all you have to do is call in and leave us your name and address, and we'll send you a booklet. We'll answer your questions day or night. And we wish you good health and good happiness. And have a great holiday weekend.
Have a great weekend, New York.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.